Hi, I'm Dr. Jocelyn, and today I want to talk directly to anyone over 40, 50, or 60 who has been struggling with blood pressure that just won't seem to stay under control. There's something happening inside your body right now that might feel invisible, and most doctors aren't connecting it to the real reason you're feeling the way you do. Your blood pressure might be creeping up, 150, 160, maybe even 170 over 90. You might be on 2 medications, maybe 3, and your doctor is likely talking about adding a 4th. But before that happens, there are questions nobody seems to be asking. Why do your legs cramp every night, leaving you tossing and turning? Why do you sometimes wake up at 3 a.m., your heart pounding, like you've just sprinted across the street? And why does exhaustion hit you like a wall around 2 p.m., even after 8 hours of sleep? After more than 20 years in cardiac medicine, I've seen hundreds of patients walk into my office with blood pressure they can't manage, despite taking multiple medications. They're often told their hypertension is stubborn or difficult to control, but I've learned that most of the time, there's a very clear, simple reason hiding behind these symptoms. A nutrient deficiency that's so common, it affects over 70% of older adults with high blood pressure. When you identify it and address it correctly, blood pressure doesn't just improve a little, it can drop dramatically. Some patients have seen reductions of 15, 20, even 26 points, sometimes even eliminating medications altogether. Let me give you a picture of how this plays out in real life. I had 2 patients, both 70 years old, sitting in my office in the same week with almost identical blood pressure readings, both taking 2 medications, both told they needed a 3rd. Richard, one of them, left his doctor's office, went straight to the store, and grabbed the first magnesium supplement he saw. Magnesium oxide, 400 milligrams, labeled for heart health. He started taking it each morning with breakfast, hoping for results. 2 weeks later, nothing had changed with his blood pressure, but something else had changed. By week 2, he developed constant diarrhea. It was uncomfortable, embarrassing, and eventually, he couldn't tolerate it anymore. He threw the bottle away and went back to his doctor, who ended up adding a 3rd blood pressure medication. Susan, the other patient, took a different path. She came to see me instead of heading to the supplement aisle. I ran a test that most doctors never order. Not the standard magnesium test, but the one that actually shows cellular deficiency. Her magnesium levels were dangerously low. I wrote down the exact form she needed, magnesium glycinate, not oxide. She bought it that same afternoon. The first week, nothing seemed different. The second week, she called discouraged. I reminded her to be patient. By the 3rd week, she woke up and realized that her legs hadn't cramped for the first time in 2 years. By week 4, her blood pressure had dropped a few points. By week 12, her blood pressure had dropped 26 points. 2 of her medications were no longer necessary, and her leg cramps disappeared entirely. This isn't luck or genetics. Richard took the wrong form of magnesium. Susan took the right one. And this difference, knowing the correct form and dose, completely changed their outcomes. Many older adults don't realize this simple nutrient can make such a difference. When your magnesium levels are low, your blood vessels constrict, your heart works harder, and your blood pressure climbs. Stress, medications, and aging all deplete magnesium, and the standard blood test your doctor uses won't even detect it. That's why so many people continue to struggle even when their lab results look normal. When magnesium is low in your body, it's not just about blood pressure. It affects your entire system. Your blood vessels are like garden hoses. When they're relaxed and open, blood flows easily, pressure stays low, and your heart doesn't have to work overtime. But if your magnesium is low, those vessels tighten up, almost like someone stepping on a hose, and suddenly your heart has to pump harder to get blood through. That's why people with magnesium deficiency often feel their heart racing, get sudden fatigue, or even experience chest tightness or dizziness. What's really shocking is how common magnesium deficiency is, especially for people over 50. About half of all adults don't get enough magnesium from their diet, and for those over 60, the number jumps to around 75%. Your body also loses magnesium faster as you age, thanks to stress, certain medications, alcohol, and even high sugar intake. Water pills, which are commonly prescribed for blood pressure, actually flush magnesium out of your system. Acid-blocking medications, like omeprazole, reduce absorption. Antibiotics, chronic stress, alcohol, and a sugary diet all chip away at your magnesium stores. This means that even if you're eating well, you may still be deficient. The symptoms of magnesium deficiency are widespread and often misdiagnosed. High blood pressure is just one sign. Leg cramps, restless sleep, chronic fatigue, irregular heartbeat, anxiety, and constipation are also linked to low magnesium. But because doctors treat each of these issues separately, you may end up with a long list of prescriptions: a sleeping pill for insomnia, a muscle relaxant for leg cramps, an anti-anxiety medication for nervousness, and another blood pressure pill for hypertension, without ever discovering that a single nutrient deficiency could be causing them all. Another reason magnesium deficiency is often missed is the standard blood test your doctor uses. Serum magnesium only measures the tiny amount floating in your blood, about 1% of your total magnesium. The other 99% is stored in your cells and bones. Your body pulls from these stores to keep your blood level looking normal, even when your cells are desperate for magnesium. By the time a serum magnesium test shows a deficiency, it's often too late. The test that really matters is RBC magnesium, or red blood cell magnesium. This test measures magnesium inside your cells, the place where it actually does its work. Unfortunately, most doctors don't order this test because it isn't standard in medical school, and nutrition training is minimal. That's why so many people are told, your magnesium is fine, even while experiencing symptoms like constant leg cramps, insomnia, and uncontrolled blood pressure. I've seen this countless times with my patients. One woman in her 70s had normal serum magnesium, but her RBC magnesium showed severe deficiency. Once we corrected it with the right form and dose of magnesium, her blood pressure dropped significantly, her leg cramps disappeared, and she finally slept through the night for the first time in years. This is why knowing the right test and the right form of magnesium is absolutely critical, especially for seniors who have been struggling with hypertension for years. Not all magnesium is created equal, and this is where most people get it wrong. The form of magnesium you take matters far more than most people realize. Richard, the patient I mentioned earlier, took magnesium oxide, the cheapest form available. He thought he was helping his blood pressure, but his body could only absorb about 4% of it. The rest just sat in his intestines, pulling water in and causing constant diarrhea. That's why he saw no improvement in his blood pressure and ended up adding another medication to his regimen. There are other forms that work a little better, like magnesium citrate, which is absorbed around 30%. But it can still cause digestive issues for many people and is often sold as a laxative. The forms that actually deliver results are called chelated magnesium, magnesium glycinate, magnesium taurate, magnesium malate, and magnesium threonate. These forms are absorbed much more efficiently, around 60 to 80%, so your body actually gets what it needs without upsetting your stomach. Magnesium glycinate is my go-to recommendation for most patients. It's gentle on the digestive system, highly absorbable, and the glycine molecule it's bound to helps calm your nervous system, improving sleep quality as well. Taking it before bed not only supports blood pressure, but can also help you rest more soundly. Magnesium taurate is another excellent option, particularly for cardiovascular health. Taurate has additional benefits that support healthy blood vessel function and maintain proper heart rhythm, so it works synergistically with magnesium itself to reduce blood pressure more effectively. The next critical point is dosage. Most people make the mistake of taking a large dose all at once. Your intestines can only absorb so much at one time. Taking 600 milligrams in a single dose may sound reasonable, but much of it passes through unabsorbed. The best strategy is to split your dose 2 or 3 times a day. For example, 200 milligrams in the morning and 200 milligrams in the evening, or if sleep is a problem, 200 milligrams in the morning and 200 milligrams 30 minutes before bed. This ensures maximum absorption and minimizes any digestive discomfort. How quickly can you expect results? It varies. Some people notice leg cramps disappearing, better sleep, and more energy within 2 to 4 weeks. Blood pressure improvements usually take longer, around 8 to 12 weeks. That's because you're not masking symptoms with a drug. You're correcting a deficiency that may have developed over years. Your cells need time to rebuild their magnesium stores, so patience and consistency are essential. I've seen patients drop anywhere from 15 to 26 points in systolic blood pressure by using the right form and dose. One woman, after 12 weeks, reduced 2 of her medications and her blood pressure was finally under control. Another gentleman, previously on 3 medications, was able to reduce his doses safely while maintaining excellent blood pressure numbers. The difference wasn't luck, it was knowledge, the right form of magnesium, and the right dosing. For seniors especially, understanding this distinction is vital. Many people over 50 have been struggling for years, adding medications without addressing the root cause. With the correct approach, you can reduce medications, relieve symptoms like leg cramps, and finally start feeling like yourself again. Now, let's talk about real-world results and why monitoring is so important. When you start magnesium supplementation, especially if you're already on blood pressure medications, your numbers may drop faster than you expect. That's a great thing, but it also means you need to track your blood pressure carefully. If you don't, you could become over-medicated without realizing it. Home monitoring is essential. Check your blood pressure in the morning and evening, record the readings, and pay attention to how your body feels. Dizziness, fatigue, or lightheadedness are signals that your pressure may be dropping too low. Work with your doctor to adjust medications safely, but never stop them on your own. Let me share a story about David, a 70-year-old patient. His blood pressure was 168/96, and he was on 3 medications at maximum doses. His cardiologist was considering adding a 4th. When we ran an RBC magnesium test, he was severely deficient. I started him on magnesium taurate, 400 milligrams daily split into morning and evening doses. 4 weeks in, he called worried because every time he stood up, he felt dizzy. His blood pressure readings told the story. Lying down, 118/68. Sitting, 112/64. Standing, 108/62. His magnesium was working, but his medication doses were now too high. We adjusted his prescriptions, and within weeks, he felt stable. 6 months later, we eliminated 1 medication entirely, and his blood pressure stayed in the perfect range. That's the power of correcting a deficiency rather than just adding drugs. Another critical point is testing. Standard serum magnesium tests are almost useless for detecting deficiency, especially in older adults. Only about 1% of your magnesium is in your blood, while the other 99% is inside your cells and bones. RBC magnesium testing reveals the real story. I've seen patients with normal serum magnesium suffering from severe leg cramps, insomnia, fatigue, and uncontrolled blood pressure. Once we addressed their cellular magnesium deficiency, they saw dramatic improvements. Even if your doctor hasn't recommended RBC testing, you can request it or use direct-to-consumer lab services. Knowing your actual magnesium status allows you to take the right steps confidently. For older adults, this is especially important because the risk of complications from uncontrolled blood pressure is higher. Heart strain, kidney deterioration, cognitive decline, and vision problems all increase with persistent hypertension. Diet alone usually isn't enough for older adults. Foods like spinach, kale, almonds, pumpkin seeds, beans, and whole grains contain magnesium. But modern farming has stripped much of the nutrient from the soil. To get 400 milligrams of magnesium from food every day, you'd need enormous portions consistently. A challenge for anyone, especially seniors. That's why supplementation with the correct form, glycinate or taurate, is necessary for most people to see real benefits. By taking the right form and dose, splitting your intake, and monitoring at home, you're giving your body exactly what it needs. You'll often notice improvements in sleep, leg cramps, and energy before you see dramatic blood pressure reductions. This is a steady, safe approach that targets the root cause of hypertension rather than masking symptoms with more medications. For anyone over 40, 50, or 60, this information can be life-changing. Here's the complete plan you can start implementing today. First, get the right magnesium, glycinate or taurate. Avoid magnesium oxide or citrate unless you specifically want a laxative effect. Look for a product that provides around 200 milligrams of elemental magnesium per capsule. This makes it easy to split your doses. Start with 400 milligrams daily, split into 2 doses, 200 in the morning and 200 in the evening. If sleep is a major concern, take 200 milligrams in the morning and 200 milligrams about 30 minutes before bed. Splitting the dose ensures maximum absorption and minimal digestive upset. Second, invest in a reliable home blood pressure monitor. Check your readings every morning and evening for at least the first month. Record them carefully. This helps you see how your body is responding to supplementation and alerts you if your blood pressure drops too quickly. If your readings fall consistently below 120/70, or if you feel dizzy, lightheaded, or fatigued, contact your doctor immediately. You may need a medication adjustment, and that's actually a positive sign. It means the magnesium is working. Third, stay consistent for at least 12 weeks. Some people notice improvements in sleep, leg cramps, and energy within 2 to 4 weeks. Blood pressure reductions usually take longer because your cells need time to rebuild magnesium stores that may have been depleted over decades. Patience and consistency are key. Fourth, consider getting RBC magnesium testing. This test measures magnesium inside your cells, the part that really matters. Serum magnesium tests are misleading because your body maintains blood levels even when your cells are deficient. If your doctor doesn't order it, you can access it through direct-to-consumer lab services. Knowing your levels helps you optimize your supplementation safely. Fifth, track other symptoms along with your blood pressure. Are your leg cramps easing? Is your sleep more restful? Do you have more consistent energy throughout the day? Improvements in these areas often appear before significant blood pressure changes, showing that your body is absorbing and using magnesium effectively. Finally, understand why this works. Magnesium relaxes your blood vessels, helps your heart beat steadily, supports proper muscle function, and regulates your nervous system. Without enough magnesium, your vessels tighten, your heart works harder, and your blood pressure rises. Addressing this deficiency gives your body what it has been missing and can dramatically reduce your reliance on multiple medications. For seniors, this is especially important. Years of medication adjustments and unresolved symptoms can take a toll, but with the right knowledge, the correct magnesium form, consistent dosing, and careful monitoring, you can regain control of your blood pressure, reduce side effects, and improve overall health. This is a safe, evidence-based approach supported by research in top cardiology journals. Don't wait. Start today, follow the protocol, and monitor your progress. Over the next 12 weeks, you may notice significant improvements: lower blood pressure, fewer leg cramps, better sleep, more energy, and potentially fewer medications. This is not a quick fix. It's a real physiological correction that addresses the root cause. Your cardiovascular system will thank you, and you'll finally feel the difference that proper magnesium support can make. Take care of yourself, stay consistent, and watch your health transform.